Rahim. Today we are going to have the third lecture of the oral medicine. And today we are going to have this important subject which is called the intraoral examination of the oral cavity. At the beginning, the intraoral examination it is considered to be as a quick general examination of the cheek, heartlet, the tongue, the gingiva, and we try to looking for any contraindication for continue the evaluation. And we are going to examine oral mucosal lesion that is appear in the oral cavity, and we are going to have some idea about what is the normal anatomical structures that is representing in the oral cavity and what is the structures that is representing in the oral cavity which is considered to be as a serious disease for the dentist, and further investigation is required about that. So at the beginning we have to know what are the general principles during the examination. First of all, we have to see if there is a presence of any oral mucosal lesion. Second, we have to know if there is associated between the systemic diseases and between the oral mucosal lesion. Because some of the systemic diseases is going to be affected directly or indirectly through taking medication on the oral mucosal lesion. Again, we have to investigating the risk factors which is going to be associated with the oral mucosal lesion. The most important risk factors that we have to deal with is the family history, or sometimes the patient may have smoking or alcohol taking, or taking any types of drugs, or any medication that is going to be affected the oral mucosa. Again, if there is any associated system with the oral mucosal lesion, and further investigation, the age of the onset, the duration, the size of the oral mucosa. At the beginning, every student and every dentist he have to investigating these structures, which is going to be mistakes during the examination. The most important structures is the stencil duct, which is considered to be the duct of the parotid, and it is going to be open on the mouth, into the mouth on the posterior buccal mucosa, opposite to the maxillary molar. Another structures which is going to be misdiagnosed during the examination is the circumvallate papillae. It is usually going to be formed as a V-shaped row, rounded papillae at the junction of the anterior 2/3 and the posterior 1/3 of the tongue. Again, the lingual tonsil also, which is found on the posterior lateral aspect of the oral of the tongue, and sometimes may be enlarged and have a viral infection. Another structures also, which is called the placa fibrobata, which is considered to be as a fold of the mucosa on the ventral surface of the tongue, or either side of the lingual frenum. Other variation in normal including the following: the fissure tongue, which is considered to be as the most common condition, and here we could demonstrate that there are multiple grooves seen on the dorsal surface of the tongue. Second, the Fordus granulus, and it is considered to be as ectopic suspicious gland, that it is mostly occur on the oral mucosa, and commonly seen in the buccal mucosa and the lateral verminiums of the upper lip. They appear as a group of yellowish slightly raised area, as we are going to see in the second slides. Again, one of the other variation of the normal, the varicositis, which is considered to be as a large vein and mostly common on the ventral surface of the tongue. Older patients mostly affected by the varicositis, and during blanching on a pressure, a glass slide or glass test tube can be used to press the varicosity. Causes of the congenitally missing teeth. At the beginning, we are going to examine the surface of the teeth. Sometimes there will be congenitally missing of the teeth, and this could be occurred due to the environmental factors. What we mean by the environmental factors is the virus, infection, toxin, or radio or chemotherapy, which is cause missing of the permanent teeth. Sometimes the genetic factors may play a role, or even though these genetic factors could be considered as a genetic factor considered to be as a dominant or recessive. The importance of the genetic factors is shown by appearance of multiple cases among the relative. Other things that we have been demonstrating is the dominant inheritance of congenitally missing teeth, like for example the hypodentia and oligodentia. However, both cases, amount and the identity of the missing teeth may vary between the relative, as we are going to see in the hypodentia. Here we are going to give an example of the recessive inheritance, like for example the recessive incisor hypodentia, and this condition described by us by a recessive gene causes of congenitally missing of several incisors, including the lower permanent incisor or even deciduous teeth also. Here we could summarize some of the anatomical variation which is going to be occur within the teeth. Sometimes there will be supernumerary teeth, which could be classified according to the morphology and the location. And here we could demonstrating, as we are going to see within the next slide, for different morphological types of the supernumerary teeth: conical, tuberculate, supplemental, and odontoma, which could be diagnosed by X-ray. Look, this is the conical shape of the surface of the teeth, as we could demonstrate it. And this is what we call the tuberculate teeth. Look how there is anatomical structures variation in this surface of the teeth. And by taking X-rays, sometimes we could demonstrating the presence of the odontoma, even though the supplemental types of teeth could be demonstrating within this slide. This is the congenitally missing teeth. Sometimes we use a bridge in order to overcome this problem. This is the congenitally missing teeth we could demonstrating by routine examination of the oral cavity. Another area which should be carefully examined by the dentist is the gingival area. There are many causes for gingival bleeding, like for example the vitamin C deficiency, vitamin K deficiency, like a long use of antibiotic may cause destroyal of the microflora of the gut. Sometimes there will be hormonal changes or a bleeding disorder, like for example hemophilia or Krasmus disease or factor VIII deficiency. even though sometimes there will be a medication used for epilepsy, for cancer, chemotherapy. Again, liver disease may play a great role. And here there will be impaired in the liver function test, as we are going to see within the laboratory examination. In a rare condition, the cancer may affect the gingival area and may associate it with a bleeding. CA of the gingival area, sometimes it's going to be located within the gingival, or sometimes it is going to be metastasis from other distant area, the gingival, as we are going to see. Therefore, common bleeding, we have to investigating many different types of medication which may cause that. Like for example, the antihistamine or central antidepressant medication, or even the immunosuppressive type of medication or chemotherapy and so on, and other medication which is going to be used for the high blood pressure and birth control product also. Even though sometimes the patient may use a blood thinner, aspirin, or any anticoagulant, like for example, warfarin, the Plavix. This type of medication may be used to prevent the stroke or to prevent the heart disease, may cause bleeding and the blood clotting problem. Another things that we are going to demonstrating during the examination of the gingiva, whether there is a gum overgrowth that we consider to be as a gingival hyperplasia, sometimes may occur or associated with a medication for the heart disease, or medication which is going to be used for suppression of our immune system. And here the plaque is going to be increased and the overgrowth of the gingival or swelling of the gingival may occur. The swelling of the gingiva is considered to be as a favorable environmental for the bacteria, and it is considered to be as affected the oral hygiene. Now the things that we have to demonstrating is that during the examination of the gingival area is the dry mouth, like for example the xerostomia. This may occur sometimes due to use of many medication, antihistamine, decongestant, antidepressant, and certain chemotherapy types of medication. All of these type of medication may affect the saliva production. Ulcer also may cause that. Again, there are different types of hormones which is going to be affected the gingival area or affected the gum, like the following hormones: steroid, estrogen, progesterone, estradiol, and so on. In this slide, we could demonstrating gingival hyperplasia, ulcerative area representing change in the color of the gingival area, the presence of the whitish area on the alveolar mucosa or on the gingival area. Another area which could be examined during routine X-ray is the buccal mucosa, and here we are going to have some idea how we are going to examine the buccal mucosa. It is usually examined by using direct and indirect vision. Then after that, biodigital palpation of the entire area should be here. Pull the tissue away from the retromolar area and try to stretch the mucosa away from the mucogingival junction. By palpating of the buccal mucosa, sometimes we could demonstrating a normal tissue of the buccal mucosa, which it is usually moist and pink or dark pink and soft. And we could demonstrating the stencil duct, as I told you, could be identified. And sometimes we could demonstrating the presence of multiple whitish area on the buccal mucosa. These whitish areas sometimes may have a different differential diagnosis. Like for example, linea alba. Linea alba, it is going to be representing as a whitish line along the occlusal surface. And sometimes, even though we could demonstrating the Fordus granulus, as we are going to see, or sometimes a whitish area, it could be representing the chronic hyperplastic candidiasis or leukoplakia, or even the white sponginovus. And sometimes neoplastic changes may be taken into consideration during examination of the buccal mucosa, like for example the erythroplakia, and here it is going to be represented as a white and red. Speckled leukoplakia, even though we could demonstrate some of the erythromomo-systemic diseases, the mucocutaneous types, like for example the lichen planus, it is mostly bilateral and associated with skin involvement, the lichen planus, or sometimes systemic lupus erythematosus, lipoma, even though the major aphthous may representing of the buccal mucosa. The systemic disease which is going to be occur erythema multiforme, and sometimes Crohn's disease, which is considered to have a multiple ulceration in the oral cavity, and sometimes it is going to be preceded the formation of any other types of lesion. As I told you, traumatic injury and leukoplakia may occur also. Here, we could demonstrating the buccal mucosa, and we could demonstrating some of the most common type of lesion. This typical finding of the lichen planus, which is going to be representing as a Wickham stria, mostly associated with skin involvement, sometimes may associated with a severely ulcerative area which does not respond to the treatment, which is called erosive type of lichen planus, and sometimes a reticular type of lichen planus which does not associate it with any source of pain. Whitish area, as we are going to demonstrating with this slide, on the buccal mucosa, sometimes white sponginovus may occur, which is considered to be as autosomal dominant and bilateral involvement of the buccal mucosa, or even though sometimes candidiasis or chronic hyperplastic candidiasis may occur on the buccal mucosa also. Again, the buccal mucosa, there is a formation. It is considered to be as a prime area for stress-related habit, such as a cheek chewing, which is called the marascotobaccarum, associated mostly in a patient with a stress. Another area which is going to be investigating is the palate, as we are going to see during examination of the palate, and this is the floor of the mouth. Here we could do, and the floor of the mouth also we are going to investigating it. And what we are going to see within this slide during examination of the palate, we could demonstrating that there is a pinpoint hemorrhagic area on the surface of the palate. This is considered to be as the infection of the minor salivary gland, as we are going to see within this slide. And during examination, we could investigating different structures, how we could examine. First of all, we study with the posterior pharyngeal wall. And the tissue in this area mostly appear as vascular, homogeneous in color, and mostly it is considered to be as reddish pink. Here the surface may be smooth, and have a small coronal peak to translate gelatin-like homogeneous surface, homogeneous, which are consistent with the normal area of a scattered lymph node tissue or lymph node aggregate. While the pathological findings include homogeneous or non-tender erythema associated with a post-nasal drip. Sometimes we could demonstrating erythema, the pharyngitis, even though ulcer or erosion could be demonstrating. مثل ما نلاحظ in this picture we could demonstrating the major aphthous, which is interfere with eating, the posterior pharyngeal area. Sometimes we could demonstrating thrush on the posterior pharyngeal area, which is here as a whitish in color. Here is the way that we could examine the patient with the patient tongue in a resting position, that is to say not protruding. We ask the patient to widely opening and say ah. In some patient there will be allowed visualization of the oropharynx. And even though we are going to use a mirror, the tongue and gently pressed inferiorly down and anteriorly forward while having the patient say, oh, this depress the tongue. This is the area which could demonstrating, as I saw in the picture. Here the dentist should look at two folds of tissue that lie on the side of the throat. This is called the tonsil pillars. Between these folds are the plate and tonsil. Sometimes, or some patients, they may have a surgically removed. And another structures, it is, as we shown in the picture, it is called the uvula, slightly raised pale yellow area may have with this structure. هذا structure مهم يوضح الانatomy of this area and different type of structures which is going to be represented. نيجي على التونسل. The tonsil is usually examined by direct visualization. And here the dentist should observe the rough lobular coronal light pink tissue of the varying amount between the anterior and the posterior pharyngeal pillars. And sometimes these nasal, it is considered to be as a large or asymmetrical tonsils, created surface, even without any evidence of erythema or exudate. Anyhow, the presence of these large crypts in the tonsil may lead to collect food or debris or bacteria. The patient sometimes may complaining from halitosis. Therefore, careful inspection is needed to evaluate the tonsil for serious disease. Anyhow, early stage of this cancer may not be very suspicious if you are going to look for it. And even after tonsillectomy, one may observe a residual of the tonsil tissue or regrowth of the lymph node tissue in the area. While the pathological finding may include dysphagia, swelling asymmetry, erythema, and even though sometimes there will be nasal obstruction and mouth breathing. This is the area of the pellet that I have mentioned before, erythematosus area representing of the pellet, nicotinic stomatitis also. Another structures during examination of the pellet. Here we could demonstrating a hemogenesis like in structures or pale pink in color. It is considered to be as firm to palpation. And here we could demonstrating the presence of the incisive papillae, which is characterized by protrusion of the soft tissue lingual to the maxillary central incisors, as we are going to see, while the raphe slightly elevated line extended from the incisive papillae to the soft palate, while the rouge corrugated lines or ridges extended laterally from the raphe, as I'm going to demonstrating this by my pointer. And this considered to be as normal structures of the imperial hard palate. Another structures which is going to be demonstrating during examination of the oral cavity is the tori of the maxilla or tori of the mandible. Anyhow, the maxillary tuberosity area, which it is mostly distal to the last molar. The tissue here, it could be homogeneous pink in color and firm in palpation. Anyhow, torus palatine is the most common atypical finding in hard palate. This tora may range and have a smooth surface texture. Sometimes it is considered to be as a large tori, or sometimes it is considered to be as a small. Sometimes it is going to be representing as multilobulated torus palatines. Anyhow, no need for any surgical operation, no need to be removed by surgery unless this tori is going to be affected the prosthetic insertion or the prosthetic appliance of the mouth. Another area which is going to be examination is the labial mucosa. And as we see, the labial mucosa is examined using direct vision by elevating the tissue over the finger or thumbs, followed by biodigital palpation of the tissue of the lip, of the lower lip, and as I'm going to see the upper labial mucosa. So we try to move tissue from side to side and try to visualize the phrenia. Normal lip tissue is a homogeneous pink in color, sometimes deep pink in color, which changes gradually to deep red color. And we could demonstrating here the prominent vascularity near the mucolabial vestibule. The tissue here should be moist and have a uniform constituent and thickness when we are going to be palpating it. We could demonstrating sometimes the presenting of the traumatic injuries, the mucoceles, or even though we could demonstrating at the angle of the mouth the presence of the cracked lip, high cracked lips. Angular colitis may representing, which is considered to be as mixed viral infection and bacterial infection. Therefore, combination of type of treatment is required for the angular colitis. Again, minor aphthous could be demonstrating or major aphthous. The lips sometimes we could demonstrating, sometimes may associate it with the systemic diseases. And in some cases, neoplastic changes may occur on the lip. As I have mentioned before, traumatic, dry cracked lip, angular colitis, aphthous ulceration, and neoplastic changes also could be demonstrating. Another area which could be demonstrating or could be examined is the floor of the mouth. And here the floor of the mouth is examined using direct and indirect vision, followed by a biomanual palpation of the entire area. If we want to examine this area carefully, we have to ask the patient to raise the tongue, making direct visual examination of the tissue toward the midline of the floor of the mouth possible. And we are going to use a mirror. And here the tissue should appear moist and very vascular. By the way, examination of the floor of the mouth is very important. And any suspected types of lesion presenting of this area, if it persisting for more than 2 weeks, biopsy is indicated or further investigation is indicated because the carcinogenic agent is mostly pooling in this area. Therefore, please do not ignore any white lesion, any ulcerative area representing on the floor of the mouth. But the dentist should know the following structures, like for example the sublingual carbuncle, which is appear as a small rounded projection at the base of the lingual frenulum, which houses the Wathen duct from the submandible salivary gland. Another structure is the sublingual fold, which is going to be representing as two oblique elevation found rotating laterally from the lingual frenum and the lingual frenum muscle attachment from the ventral surface of the tongue to the floor of the mouth. And the way that we could examine by biomanual intraoral palpation with index finger of the non-dominant hand, supported extraorally by the fingers of the dominant hand, which allow the dentist to feel the structures of this area when they are compressed together gently. We could demonstrating the presence of the traumatic injuries, ulcers, mucocele, ranula, sialoliths or stone inside the duct, and the neoplastic changes, which is sometimes representing as ulcerative area or a whitish area, and the Ankyloglossia, which is considered to be as a pathologic only if it is interfere with the normal development of a proper speech. Here we could demonstrating the floor of the mouth, the ranula, the whitish area, which is considered to be as a serious condition on the floor of the mouth. So now we are going to review what we have mentioned before regarding the intraoral examination. First of all, there are general principles which is responsible about the examinations. Second, examination of the teeth, examination of the palate, of the hard palate and the soft palate, examination of the buccal mucosa, examination of the floor of the mouth. And we discussed most common types of ulcer and lesion, which is representing in each area of the oral mucosa. And we have an idea which is considered to be very important regarding the normal anatomical violation of the oral cavity. And at the end of this lecture, the dentist and the student have to know what is the anatomical violation and what are the lesion and ulcers which is required a further investigation. So thank you again and ready to answer any questions from you. Thanks again.